The topic for today is to discuss regenerative medicine procedures and make us to all understand the possible medical conditions that can be treated. So in other words, the goals of today's presentation is to create awareness about regenerative medicine, which is the adult stem cell therapy and platelet-rich plasma therapy. I will define those as we go, and by the end of today's presentation, we should understand what medical conditions are treatable as of today. And also, please, which I will repeat over time, time is of essence when you are trying to consider one of the procedures of regenerative medicine. The earlier, the better, and the less expensive it is. And this regenerative medicine works best for most acute issues. You will find out what I mean as we go. And also, there's a lot of hype around stem cell therapy. We are not promising cure, but there's always going to be incremental improvement that current orthodox medicine may not be able to offer us today. So that's the advantage of the regenerative medicine. In other words, when we say that, or when orthodox medicine says it is over, regenerative medicine says we may just be getting started. And most very important, as we know, there's now difficulty in even getting visas to travel abroad. So we hope that we can also help to reduce medical tourism, one patient at a time. And by creating this awareness, we want people to understand that there are centers, different centers in Nigeria, where they can get regenerative medicine procedures. Not only at our center, but what is important is people need to know so that we don't die in ignorance. Knowledge is power. So without further ado, let's get started. Regenerative medicine is the process of replacing, repairing, restoring, or regenerating the human cells back to functioning state, and mainly using the cells or tissue of the body. So I like the way Mayo Clinic in USA define it as, that area of medicine that has the potential to fully heal damaged organs and tissues, offering solutions and hope for people who have conditions that today are beyond repair. So what does it comprise? It comprises platelet-rich plasma therapy. That is when you use the patient's own blood, and also stem cell therapy. Under stem cell, we have about 3 fields or 3 subdivisions. That is embryonic stem cells, which many people, most countries are against for ethical reasons and religious reasons. Then we have the induced pluripotent stem cells, some of which are in research, some are already in clinical trial. And then the last but not the least, adult stem cell therapy. Down the road today, if I say stem cell therapy can do this clinically, what I mean is adult stem cell therapy, not all the 3. So please take note. What we're going to be discussing today, again, is PRP and adult stem cell. So I'm going to start with PRP, then talk about exosomes, which is under adult stem cell therapy, and then we talk about the fat, bone marrow, and umbilical cord stem cell therapy. So what is PRP, or platelet-rich plasma? It is sometimes referred to as the liquid gold. And you can see on the right upper corner of the screen, that's the plasma, it's yellow, so that's where the name came from. And it is from the patient's own blood. It contains stem cells and growth factor. To get stem cells in the blood, to be able to harness it, it has to be processed in a proprietary way. Because that's why some PRP, people say it works, some say it doesn't work. PRP does work. You will see as we go. And the PRP, or platelet-rich plasma, is that yellow part of the body, yellow part of the blood that has been enriched, with platelets. and can go on average 5 to 10 times. But if it's well prepared, like I said earlier, it works. If it's only been enriched like 2 times the standard, the efficacy is very small. And that's why you hear some of your friends saying that PRP works, others will say it does not work. So it's important how it is prepared. And the platelet-rich plasma contain growth factors and cytokines. These are actually what makes the cells in the body to multiply and make our tissue to regenerate. Of course, adult stem cell does the same, even better than PRP. Many hospitals in USA use PRP. It helps the patients to get a better outcome and prevent, let's say, the orthopedics, for example, they like it a lot. It helps the healing process and prevent readmission to the hospital. Hospitals and clinics in Nigeria too are also using PRP. Yes, some may not be getting great results, but I think those ones now are aware that the way they process their PRP has to change, and so that they too can be getting great results. So what happened is that there's regeneration of the tissues, there's growth and repair that will continue for many months, and the results are permanent, except in some cases whereby if you do not treat the underlying medical condition, even though you get results, so it's going to be like tug of war. The underlying condition will try to bring things back. Otherwise, you get permanent results. So now let's talk about what you can do with PRP. You can use PRP to treat anything that you can touch physically. Stem cell you can use to treat both what you can touch physically and what you cannot touch. Like somebody has a stroke, you cannot touch the brain. Somebody has diabetes, you cannot touch the pancreas. In that case, you need adult stem cells to treat those ones. But if you can touch like the joint, like the scalp, like the face, you can use ordinary PRP. And also, I would just like to mention that PRP is like the basic, while adult stem cell therapy is more effective, more aggressive than just the PRP. PRP again, for those joining late, is the growth factors that we get from your blood, which are contained inside the platelets. That's why they call it platelet-rich plasma. Now, for cosmetic application, you can use it to look younger. For women that have acne, for example, even including men, they can also, if they have acne scars, you can use PRP facial to, lessen the appearance and rejuvenate the skin of the face. You can use for breast lift. It has medical applications as well. The first on the list is O-shot. That is for women that have maybe female sexual dysfunction. Some people, because of the age, they are going to menopause, they're in pain, they and their partner cannot enjoy themselves as they used to, or there's lack of desire. O-shot can restore all those things. And some part of our country in Nigeria, female genital mutilation is common, and the poor kids have no control. It's only when they get old, then they find out that this was done to them when they were babies. Then PRP therapy can also be used to, to bring things back towards normal. It's good for urinary incontinence. Men are not left out. It's good for premature ejaculation, erectile dysfunction, Peyronie's disease. Another medical application is hair regrowth. If the hair thinning is because of thyroid, you correct the thyroid function, and then if you use PRP to promote the growth of the hair follicles. If it's traction, either from hair costa or whatever, you can also use PRP. Another very important area is diabetic wounds and generally chronic wound that will not heal. PRP can accelerate the healing process. Orthopedic application is large. That's why orthopedics doctors they love it. If people have pain in small joint, medium-sized joint, large joints, neck, back, you can use PRP to remove those pain or lessen them. This is the first slide of just showing you some PRP testimonials. This is a patient that on the right corner, right lower corner, you can see there's a problem in the spinal cord. I know some of us are not doctors. What I circle in the center is the injury, and so patient is paralyzed because of the problem on the spinal cord. Because of that, patient could not move. So patient ended up sitting on his butt and developed a bed sore that will not heal for about a year. So a combination of PRP and SVF was used to treat this patient, and within 6 days, you can see how it dried out. Within 3 weeks, there's already healing, and 2 months later, some that will not heal in 1 year, you can see it yourself on the screen. This is called vampire fascia. Some people do not want surgery. They can look younger, new collagen blood vessels. It's not only for Caucasian, like I said earlier, even you can use for acne, so it's good for Africans as well. Hair loss, men, women, And this is somebody with testicular atrophy, shrunk balls. And what happened is that you can see this is the left testicles, which later on was treated, and about 15 months later, it turned to what you can see on the right upper corner of the screen. And then when it was compared to the normal one, which is the right one, the texture are the same, unlike before. And that, of course, in orthodox medicine does not happen. So that's where regenerative medicine comes in to help to regenerate and restore things back to normal. This is a gentleman that was treated in 2017. And when 2 months later, when we followed up with him, he said there's improvement, and his working is harder and is good. Probably didn't tell his wife, but 9 months later on his own, he just sent a text saying that, he's happy with what is going on in his family. I'm not sure if there are kids also in the background watching this with adults, because there's going to be some of the testimony that I may have to read out. So please, let's take note. This is another patient with diabetics that was treated. So, and later on decided to have P-shot. So we did about using adult stem cells. About 3 sessions were done over 2 years. And what happened naturally is that his score increased from 15 to 22. And then he still wanted it to be perfect. It's already back to normal. And so he was treated. The next day, he asked if he could be active, and the answer was yes. Then, what happened is multiple phone calls the next day, and he sent a text that, the potency is good, it's stronger, it lasts longer. He had also some unpleasurable experience, and then his condition was restored back to normal. Mind you, before we get excited, this patient already had 3 sessions of stem cell therapy for his diabetes, which is the underlying cause. That has already been corrected. So the P-shot was just, pushing him off the cliff. That is why within 2 days, he was able to have this result. Otherwise, it takes 3 months if all you do is PRP. So please keep that in mind. It's not only for women, for men women too can also benefit for sexual dysfunction. And this is a young lady, 31 years old, that came in, from Chicago to Tampa, because just to have an autistic boy treated. So when we follow up about 16 days later to find out how the boy was doing, she went further to tell us about how she too is doing, because on arrival, she found out that we do shot. So she said if she could do it, but I say yes. And so our experience was that she's been stressed, of course, because of thinking of the kid, lost interest in many things. But 16 days later, she had more lubrication, no more pain. There is urge, there is desire, and the orgasm, of course, was stronger, and she feels less stressed. Also, women respond better, faster than men when it comes to the sexual dysfunction. That is just a given, and the men will sometimes may need a repeat treatment, while women, all they need is just one time, and they're good. I believe, oh yes, this is the female genital mutilation slides, and this is someone who I followed up with 2 months later. Mind you, all shot for somebody who's regular and respond fast. In mutilation, things are being cut off. So it's not going to respond as fast as somebody who did not have mutilation. Therefore, she did not respond to me at that 2 months because she has not seen anything. But later on, 3 months later, when she started noticing improvement, she sent me a text that there's more sensation, and that she has not been with anyone yet, so she couldn't tell of the full effect. Then 4.5 months later, when I tried to follow up if there's any additional improvement, he said yes, that she can confirm that our current levels of sensation are better than when she first received the treatment. And even since the last month that I followed up with her. So she started having improvement. Then 10 months later, when I followed up, she also had treatment for her neck, knee, as well as O-shot. So she now decided telling all the stories. But what is important right now is the O-shot for the female genital mutilation. So I'm going to rush over the testimony so that we can understand what she went through. So hopefully we can read the right side of the screen, but you can read with me. I was partially circumcised as a baby and was only rescued from a full mutilation because my mother rescued me free from the perpetrators. To the full-fledged anger of her in-laws. She didn't care. She ran away with her baby girl, but the work had been partly done. Fast forward 36 years, and having suffered from vaginismus, enjoying sexual relationships with my husband was something I never fully experienced. I couldn't feel anything, and so could not experience the pleasures of the intimacy. I had a course of the O-shot, and in 3 months, I started to notice significant improvements in having sensations, even in the normal course of the day. That is not even without activity. The nerves endings were growing, and she could now, feel what she never felt for 36 years. And she's thankful, very thankful, and she was able to provide that we're able to provide a service that allows her enjoy a level of intimacy and pleasure in her lifetime. So that's for someone who didn't enjoy their marriage initially, that believe that's a breakthrough that orthodox medicine cannot offer. So just trying to show you that there's hope with regenerative medicine. And this 87-year-old lady with arthritis who came in, we treated her with PRP, and then I saw her 3 months later in Lagos, Ikeja, and she came in with wheelchair, and 3 months later, no cane, no wheelchair. She walked to the exam room. And then later on, about 9 months, one of the the children sent me a text just to say thank you. And this is someone with 72-year-old with back pain. I know most of us are not medical experts, but on the right side is MRI. In that circle, I mean, you can see from the top, things are smooth, they start getting worse here, and then you see this is really bad here. So she has back pain, and when it is narrowed, the spinal canal, we call it lumbar spinal stenosis at that level. She has back pain. This lumbar spondylosis is when you have arthritis with age. Arthrosclerosis means the one bone is sliding forward over the other, which is what you can see here. And then, of course, the pain goes down our legs. That's what those diagnoses mean for the non-doctors. So in summary, 2 days later, we followed up, how are you doing? She said she has already noticing some improvement. And then when we asked her to quantify it, she said that her pain was 7/10 before. 2 days later, it has dropped down to 5/10. And then 25 days later, dropped down to 2. 32 days later, dropped down to 1.5. So she was happy. And then 6 weeks, 1.2, gradual improvement. Remember, this is only PRP. And then by 7 weeks, 1/10. By 3 months later, she was pain-free with occasional 0 to 1 episode. If it is stem cell, which we'll see some later, the result is faster. So again, orthopedics applications are huge. If somebody has a diagnosis of back pain, or they have facet arthropathy, if they've seen it on their medical records, something like this can help, or you can talk to your doctor. If they offer the procedure, it will help you. Arthritis, rheumatoid arthritis, rotator cuff tear, ligaments in the knees, that's the ACL, PCLS, if they are torn, especially the partially torn, without surgery, it can be reconnected. If you have pain at the bottom of your foot, plantar fasciitis is very good. It helps to eradicate that instead of using steroid. So pretty much any joint that your doctor is putting steroid, which eventually damages the joint, it's better to use one of the procedures of regenerative medicine. Not only does it take away the pain, the inflammation, it regenerates. Steroid doesn't do that. Steroid only damage. It will help the joint, reduce the inflammation at that moment, then you come back again, maybe 2-3 months, and then a year later, you are being asked to get knee replacement or hip replacement. Oh, by the way, which you will see one down the road. So exosomes. We've spoken about PRP. Exosome is next, which is under adult stem cell therapy. Exosomes are just tiny particles. They are very small secretory packets that control the stem cell communication. They don't have any nucleus in them. And so, but they play a very important role in cell-to-cell communication and cell signaling when it comes to adult stem cell therapy. So these are the exosomes. A whole cell, you can see it on the right side, it has nucleus, but exosomes do not have nucleus. So they are very tiny, but they have all the information you need, for the stem cell therapy, or the mRNA and the RNAs. So DNA is not needed for stem cell therapy. And these are testimonials for people that have had exosome treatment. All of us that are in Africa, we are skin type 6. This is South American patient who's also type 6. Second degree burn. In Orthodox medicine, yes, we put the burn cream and dressing and all those things, but you still be left with scar. 7 days clean, 2 months, no scarring. That's only possible with regenerative medicine, not Orthodox medicine. This is another exosome, another patient treated with exosome. There's perforation by the cutting board. We shouldn't be cleaning our head canal with that. But in this case, there was accidental perforation of the tympanic membrane, which is the eardrum. And then 3 days later, the patient had exosome treatment, and then something that's supposed to close in the average of 4 to 6 months, it closed in 3 weeks. Then 4 weeks later, picture was taken, and you can see how it has closed up nicely. There is no trace of any scarring. That's another thing. Adult stem cell therapy prevents scarring. So like somebody has a keloid, you have surgery, you can also inject exosomes after the surgery. And then 10 months later, crystal clear, as if nothing ever happened. So we can also use for diabetic patients, and this is somebody within 6 weeks of getting exosome treatment, the hemoglobin A1C dropped from 10.5% to 6.52% in less than 2 months. And if you notice at the top, the patient was only diagnosed 4 months earlier than this treatment. Exosome works very, very well for acute problem, stroke, diabetes, ear perforation that I showed you, the facial skin burn. So again, like I said earlier, the earlier, the better, and the better result you get when you want to use any of the regenerative medicine procedures. Please let us take note of that. No need to procrastinate. This is the patient that was treated in America, that the mother came and treated with O-shot. So that's 16 days later that we tried to find out how the 3.5-year-old boy with autism was doing. The mother said he's more calm, willing to listen, he's better with his emotions. He hugs his little brothers, good morning. These are things he never did before. This speech therapist said that he has better understanding and is trying to make some sounds that sounded like words. He was able to match puzzles all day by himself without any help. And then 6 weeks later, we followed up, and then the mother said there's still much progress going on, though he is not yet there. And then she also said that he's trying to say some words. It doesn't come out right, but at least he is trying, and that it doesn't do before. Now he can pronounce at least 15 alphabet sounds. And before, you could never even get him to, you could never get him to repeat or pronounce anything. So we've spoken about PRP, we've spoken about exosomes. Now we are going to talk about fat, bone marrow, and umbilical stem cells. Or let me say, we're going to talk about adult stem cell therapy. Now, remember, PRP is from your own blood. These are platelets that have growth factors inside. Exosomes, even though it's under stem cell therapy, they are extracted from cells. They are not cells. But now we're going to be talking about cells. We're going to be talking about adult stem cells therapy. And what is a stem cell? A stem cell is any cell that can multiply or differentiate. All of us online, we came from one ovum that is fertilized by a sperm, and that's one cell is what turned to all of us and differentiate to our head, our leg, our stomach, and lungs, and so on. So that is what a stem cell is. There are 3 major types of stem cells. The embryonic, that's the first one that came out, and it's the most powerful, and it has this pluripotent characteristics, but it is considered unethical because it involves potential human beings, which the scientists get from IVF clinics. So religious groups and some countries are against it. Now, because of the power, the pluripotent power, the scientists now went further and decided to create induced pluripotent stem cells, whereby they take the mature cells like your skin or white blood cells, and they reprogram it or they culture it. So it has the same power like embryonic stem cells, but it doesn't have the ethical issue. So some of it are already in clinical trials, while some are still in research preclinical stages. What we're going to be talking about is this evening is adult stem cells. Again, if I say stem cells, I'm technically referring to adult stem cells. And that is cells from any individual that has been fully matured, is of any age. That is why umbilical cord stem cells is under adult stem cell therapy. And it can also be from the bone marrow or fat in our stomach. A lot of clinical trials have been done. This is considered safe, so that is why we're able to use it clinically today in America and as well as the rest of the world, including Nigeria. How do they work? They work by paracrine effect, that is cell-to-cell communication. In other words, they do not know why you are transplanting it or why the doctor is transplanting to the client. What happens is that once they are flowing in the body, the area of inflammation, either acute or chronic, attracts these stem cells. There's what we call receptor, on all these abnormal cells, and there's a signal that drives the stem cell towards them. We also call it like a homing, like the birds flying, going home. So the stem cells get attracted to the damaged part of the body, and they make those area of the body that is damaged to multiply and start repairing themselves. Naturally, we are created to repair ourselves. That's how God created us. But the stem cells accelerate that healing process. So some that's supposed to take maybe 9 months might just take 3 months or 3 weeks. And you don't have to deal with it. And then you can even prevent some complications of somebody having acute stroke. Yes, you can recover, and some may be left with numbness or tingling or weakness for many years or the rest of their life. If you address that acute stroke in the acute stage, one treatment is all you need. You can stop all these complications and get the person back on their feet. And I think there's a video, a 1 minute, 2 minute video on that. So let me keep moving. And then they'll be happy. So in other words, regardless of the number of conditions that is treatable in that patient, the stem cells do not know why you are treating the patient. Everything gets treated once transplanted. And the sources are the fat in the stomach, your bone marrow, or umbilical cord stem cells. None of us on the line can use our own umbilical cord, although the kids born today, their umbilical cord blood are being stored. And if any of us needs to use umbilical cord stem cells, which do not cause any immune problem, we have to get it from another person, from a donor. So anyway, there's tissue degeneration, yes, you can use adult stem cell therapy. And even some conditions that you've not known that they are still just starting, it will calm everything down. So that's why it's good for anti-aging. I mean, of course, it has its limitation. It's not the answer to everything. You break your bone, you need to get orthopedic doctor to realign that bone. Yes, you can still use PRP or stem cell to accelerate, to shorten the duration of the healing process of the broken bone. But that is not the first thing you do when you break your bone. You go and see a doctor. If you have pneumonia, you have malaria, you still have to go and see a doctor. So it is not the answer to everything. Of course, it is offering hope for conditions that before we thought could not be treated, and they are now treatable. We've been saying regenerative medicine, but the scientists found out that autoimmune disorders respond a lot to regenerative medicine procedures. So things like rheumatoid arthritis, lupus, Crohn's disease, autism, multiple sclerosis, even chronic fatigue, it helps. It helps for type 1 and type 2 diabetes. For the heart condition, 2 conditions are the ones that it is known for. The heart attack, if somebody has heart attack, MI, it means a section of the heart tissue was deprived of oxygen and is dying. The stem cell therapy can help to repair, regenerate that heart muscle. Or heart failure, that means they can't pump enough blood around the body anymore. It helps to modulate, regenerate the heart tissue, and the heart gets stronger over time. Lung condition as well. Stroke. I've been using stroke as example a lot, because that's where we get probably one of the best places to get the wow effect, especially the acute stroke. Once there's acute stroke, you don't start looking for regenerative medicine center. Take them to the nearest hospital. Let that person be stabilized. Within 3-5 days, everything has been, test has been done, blood pressure controlled, whatever is causing it has been addressed. Then other stem cell therapy can be done while they're in the hospital or after discharge. What is important is it needs to be addressed immediately, within 1 to 3 weeks, so that that person can only have just one treatment and fully recovered. For old stroke, 2 years, 5 years, 3 years, yes, it too will get improvement, but mind you, at this point, part of the brain is dead. So you can not perform magic. You have to start, grow new brain cells. They grow, then they differentiate to perform the function of the one that is dead. That's going to take time. That's going to take time. It's going to take multiple sessions. Of course, it becomes more expensive. That is why the earlier, the better. Cerebral palsy is stroke in kids. So that one too can be treated. We've done some people, kids that cannot walk, they start walking. We've treated them at our centers in Nigeria, So it's a possibility. We've spoke about male and female sexual function already. Arthritis, I think we mentioned that already. Low back pain, neck pain. Some conditions like motor neuron disorder that's technically considered death sentence. You can prolong people's life. You can stop the deterioration, because once you are diagnosed with MND or ALS, you just keep going down. But with stem cells, you can abort it. Hands that is not moving for 2 years, you start moving. Legs that is not moving, you start moving. But again, you also need more than one treatment session. So developmental delay in children, spinal cord injury, if you get it addressed quickly, somebody that is paralyzed, you can, within some months, get them back. If the spinal cord injury is old, again, it will take longer time and multiple treatment sessions. Please, again, remember, time is of essence. Anti-aging, if there's nothing wrong with you, great, but you cannot be as agile. You cannot be as functional as you were in your 30s and 40s. So something is already deteriorating, wearing off in the body. Stem cell therapy, adult stem cell therapy does not know why you are giving it. Once it's transplanted, it repairs and rejuvenates the whole body. We're all going to die one day, whether we like it or not. Okay, I know it's a different topic of what is going on, how you can prolong your life, and that is for future. But as of today, it's no fact that we're all going to die at one day. But you may want to die in good quality, or in good condition. And then, people get anti-aging treatment. Some, depending on their condition, once a year, some once every 2 years, some every 6 months, your choice. Sexual function, restoring relationship in marriages, that has been discussed. Now, the question in mind of some of us is this safe or not? It depends on what you're talking about. If you're talking about the embryonic, the answer is no. That's why many countries are against it. And if you talk about induced pluripotent, the answer is yes and no. Why? Because the scientists now, it used to be no. The scientists now believe they can make it safe. So they've started clinical trial in human beings. But adult stem cell therapy, that has been going on for donkey years. A good example is bone marrow transplant since 1968. We just didn't call it stem cell therapy then. People take fat in their stomach, put it in their lips, in their face, in their butt. There's what they call the Brazilian butt lift. I think that is very common in Nigeria. So it's your own body part. You cannot go wrong. So it is, the answer is yes, it is safe. Now, this is a table also addressing the safety. On the left is embryonic, induced pluripotent in the middle. On the right is adult stem cell therapy, which is one that is safe, and that is called somatic stem cells. So it's the same thing. And the reason Why they are safe is because for the two left columns, they are very powerful, pluripotent, but there's a limitation to the adult stem cell. That's why I say they are multipotent, not as powerful as the other two. The other two can cause chimeras. Adult stem cell cannot cause any form of chimeras. The embryonic and the induced pluripotent, they have, they just keep self-renewing. There's no limitation. Now, the adult stem cell therapy has limited self-renewal. That limitation is actually what made it to be safe. So it doesn't allow it to continue to renew and multiply. That's what makes adult stem cell safe. So they have limited lifespan, unlike the other two that is indefinite. So these are things that make it safe. They don't cause no cancer. The other two, may cause cancer. So again, adult stem cell therapy is what is clinically safe. It has been proven to be safe. If anybody is in the medical field or is very curious about science, please take a screenshot, go to www.nih.gov. It's the best website. It's a US website for National Institute of Health. You type in whatever you want. Adult stem cell therapy for any condition that comes to your mind. You get articles, things to convince you if it is possible. Whatever, multiple sclerosis, diabetes, just type it in there. So now I've spoken about all the three types of adult stem cell therapy and PRP. I'm now just going to do some testimonial. These are patients that have been treated either in US or Nigeria. The first patient was treated. This patient was treated in I believe 2018. Yes, 2018. Patient has neck pain, low back pain. You can even see some scoliosis there, and then some disc bulge, on the left side. So, but when we followed up for the multiple pain conditions, 2 days after, 12 days after, and they said there's about 80% improvement, significant improvement, tremendous improvement, and mom is without back pain. But the reason why I'm showing this slide is that when they came for consultation and during the treatment, they never mentioned anything about the dry eye condition. During the follow-up, they said she also had severe dry eye problems, to where she would wake up many times for drops. Since this procedure, 12 days later, she has noticed no problems with the eyes. And like I said earlier, it doesn't know your diagnosis. The stem cell just go around, anywhere there's a problem, it fixes it, period. This is another patient with neck pain, also treated in 2018. This both at the Tampa office, even had surgery and was still having pain. So 2 days later, we followed up. This patient did triple dose fat stem cells. And how are you doing? He said the neck pain and the hand pain are gone, feeling good, but the Crohn's disease was iffy, but no pain. In other words, the patient doesn't know if his autoimmune condition is going to be benefited by the treatment he had, even though he stopped having pain. So, okay, like I said earlier, on average, it takes 3 months, even sometimes 6 months in some people to get results. And some people earlier than that. The next thing is 5 days later, it sent me this long list. The body pain gone, craving gone, no depression, motivation good, sexual life improved, sleep improved, and hair growing, no side effects, and no more headache, no more habit of nail biting. So that is what he said. Now, I like this case because this is one of our cases that are going to be publishing, writing an article to publish soon. This patient was treated for the left, or the patient has arthritis of the two knees. And then they came to the US. She was treated in 2019 with left knee replacement, and also told to get knee replacement for the right, but she refused. And she was having arthritis, getting steroid. Like I said again, I'm not a friend of steroid. There's nothing wrong. They help you, but on the long run, the damage is just not worth it. Then all we had was steroid to help the patient. So there's nothing wrong. That's all we need. But now, from 2017, continue to get steroid. You can see how the left was messed up by 2019. And then what happened? She ended up getting total hip replacement. Then the left also got worse, but she refused to get two hip replacement at the same time. So this X-ray was taken 3 days before we treated her. And then 2 days later, our pain went from nerve attend to 3. 3 weeks later, from 3 to 2, about 51 days later, 2 to 1, by 3 months, pain-free. And she's pain-free up to today. And what happened? Right in front of you. This is 3 days before X-ray. And you can see it's the same patient. You can see that, These are all the arthritis, and it started improving. And then here, you can barely see any space. By 6 months, there's already space in between the two bones. I hope you can see that on you. And then, so putting them close to each other, you can see the improvement, And then, of course, all the cysts are gone. 10 months later, you can see, better, more spacing. And then 14 months later, it has gone from this to this. In orthodox medicine, this does not happen. The treatment is total hip replacement. But regenerative medicine can regenerate. So if anybody tells you that it doesn't work, you don't need to be a doctor. You can see with your 2 naked eyes, it's the same patient. You can, so that is that. This is just comparing the progress. Again, it's continual improvement, gradual improvement. Going, for every, for different conditions like acute stroke, you resolve it immediately. This is an old arthritis that got worse to this point before we started treating, and then it cannot, even though the pain is gone within 3 months, the regeneration is still going to continue. So these are other patients. I'm trying to watch time, sorry. So to see how much time we have. I want to keep this less than an hour so that we can have question and answers session. This is a patient with diabetics, high blood pressure, who was taking ibuprofen, and then the kidney got damaged, and then for 15 years, patient has been on dialysis. So, all this I'm going to repeat because you may not be able to see it. So looking at the right side, so we follow up 3 days later, the patient responded 4 days later, and said that the first thing he said that his skin seems smoother than the previous rough skin that he has because of his kidney condition. I was able to read newspaper clearly without glasses the next day. He slept very well. Most of our patients sleep very well, and the sleep pattern, improve. So if you're having problems sleeping and your doctor has tried out medications, it's not working, ask your doctor if they can treat you with one of the regenerative medicine procedure. It will help you, wherever part of the world you are working from. So this stool texture improved. 9 days later, he said normally it takes 9 days. He didn't have dialysis, and the creatinine level only went up by just 2 levels. So normally that doesn't happen to him. So when he went back for dialysis 9 days later, his blood pressure was fantastic throughout dialysis. First time ever in 15 years. So this is another screenshot of his testimony. And what did that say? It said his blood sugar have become very normal, but he now even skipped the drug so that the sugar and blood pressure did not become too low. He registered 100 over 60, 90 over 50. So his blood pressure medication had to be adjusted down. And then, of course, the skin scales have long gone immediately after the stem cell. By almost 6 months later, he stopped blood transfusion because his PCV was getting above 40, and then it was also getting epogen injection. So they have to stop epogen injection too, because they said it was getting too high for his dialyzer. So that's the kidney was functioning better. So I now went ahead, and because the total body regeneration, remember he had a complaint of ED, but we did not do P-shot. So I now asked him, what about your sexual function? He said, quite frankly, the sexual function had improved despite his kidney condition. The reason why that happened is, again, the total body regeneration. So the brain was made to produce more testosterone, which now makes the boss to produce the, more testosterone, because the brain releases the hormone that stimulates the boss to produce testosterone. So that is total body regeneration example again. This is a patient with back pain that was treated, I think, October 1, some years ago in 2018. So the next day, when I sent a text to find out how he was doing, he said, yes, he was able to sleep on the right side, without the usual severe pain that normally wake him up. And then 4 days later, he said his sleep is deeper and longer and feel more refreshed than before when he wakes up. And I said, okay, what about the pain level? He said that's tremendously reduced. That's gone in 4 days from 7.5 to 2.5. And 12 days later, he said he said he was traveling, and he did not feel any pain in his lower back or both hips again, So mind you, he got fat. I told you about a lady before that, I think 6 weeks, 7 weeks, we were still 1/10. And this is 12 days at 0. There's a difference between PRP and adult stem cell. PRP is like the basic entrance. I like to use car to explain sometimes. PRP is like, let's say, Toyota Corolla, while fat or adult stem cell is more like the faster cars, or even like airplane. So 4 weeks later, when I asked him, okay, your pain has gone from 7.5 down to 0. Is there any other changes that you have started noticing? So that's when he now said he couldn't stand for more than 15 minutes at a time before. But it was that same day now that I just accidentally followed up. I was able to deliver 2 papers, and he stood for 1 hour and 2 hours respectively. And then verbally, only to find out later when he went to US, he drove 8 hours, non-stop, because he traveled from Nigeria to US after that procedure. And he couldn't sit long or stand long, and he was able to drive that, on the road. So he's doing well, he's pain-free. This next patient is another patient that went from Nigeria to US. They offered total knee replacement, on the left, because you can see the bone-on-bone arthritis. She refused. She wanted not to do surgery, so she found out about the procedure. So instead of doing surgery, her pain was 6 on the right and 7/10 on the left. 11 days later, that reduced on the left to 4 from 7, and then on the right from 6, it reduced to 3. About 5 weeks later, it further reduced down to 3, and 2. And so she was happy that she did not get knee replacement. We already spoke about this lady, about this gentleman that had improvement in his performance after having a P-shot when he already had 3 sessions of stem cells. We already spoke about this before. I wrote an article about the non-healing wound, the Nigerian patient. I submitted in 2018, and it was accepted by the Journal of Medical Cases. They published it, we already discussed this. Now, this is the stroke patient. I think a couple of minutes left. This is a stroke patient. Okay. The patient could not speak, could not talk. So 5 days later, we went into the hospital, we treated her, and then what happened was that, let me fast forward it. The next day, she started in her hand, as you can see, and she also started talking. And then that's the leg. You can move that, you can see that. Then the 3 is already bending more. Day 24, she's able to raise the leg during physiotherapy very well, and she's able to walk without a cane. She can start walking, and 53 days later, walking freely. She only had one treatment. And then by 2 months, the daughter went to visit her. She was like walking faster than the daughter. And the daughter's like, oh, it's because of your grandbaby. So that's just to show that life can be restored. That somebody couldn't move, couldn't speak. Now, this is another patient that had a stroke at the back of the brain, 3 weeks old, and affected the vision, the headache. Patient was treated, but 14 hours later, half of the symptoms were gone. By 3 months later, everything was gone. The reason I'm showing you is that we treated the patient for stroke, but look at the diabetic hemoglobin A1C. It went from 6.7 in 2 months to 4.04. Again, stem cells, other stem cells does not know why you're getting treatment. Anyway, there's problem. It will try and repair the issue. I know many people on the line, different conditions. Of course, we have many cases. So I'm just trying to show sample of as much as we can. Of course, we not live here today if I have to touch everybody's case, but just hopefully the concept is clear. This somebody with that was a non-bleeding stroke. This one is a bleeding stroke. And then 12 days later is when they contacted us. Patient could not recognize the husband. Then 12 days later, after the treatment, I now contacted the husband. He said the wife was able to recognize people, including him, and then now we're able to walk a little bit, and hopeful that there'll be more than that. This is somebody 75 years old, back pain, who needed a cane to walk around. I told him 3 days later, sent me this, that how she's able to stand up upright better without walking around with a cane. And then 3 months later, she sent me this video from our location in Akure. I was in the US. So I'm going to fast forward it. Anyway, that's before the treatment at our center. This is our center in Lekki. We take the baseline of what they can do. And then few hours after, she was already doing better. The next day, she slept soundly again. Everybody sleeps very well. So let's keep that in mind. And then he said the pains are gone. But let me fast forward it. So 3 days later, I need to fast forward that. Sorry for the, yes, better now. Okay. So 3 days later, she's already said that she's doing better. No more pain in the buttocks. All right. I just want to show you a section. I can't fast forward it the way I want. Yes, this is where I want you to see. Look at the angle at which she stood up. So she sent me this video on herself. She has a back and terrible back. I mean, the myelopathy is really serious and without pain and continued gradual improvements. Okay, so this is somebody who's paralyzed. This is on our social media website. I'm going to play it while I talk. Patient was shaking first of all, he was having a jack movement, and by 2 days later, instead of every 10 minutes, he only had 2 by the evening. You can see 9 months later, let me show that we didn't miss that. Let me go back. 2 days later, I was moving his hand. 9 months later, this is a patient that has not been able to move his hand or leg for 2 years because he had a spinal cord injury and they crushed his head on the floor. The neurosurgeon saved his life and they did the compression surgery. So, but he remains paralyzed for 2 years. We got involved and then started moving. And then from that slow movement to faster movement. And then, okay, if you notice the speed on the left, it's a little bit moving faster. And if you now turn him, he was able to turn himself backwards. So the degeneration was going down. These are cases that I'm saying, if you bring such cases to a center where they can offer regenerative medicine, the patient will be able to walk by 2 years, So this is autism. Because of time, there are so many testimonial on autism. This is another happy person with the, that's from UK. Let me just keep going. I'm not going to, okay, this is a 1-minute video. So I'm going to keep quiet. This kid could not follow instruction properly, but later on was able to. Let's see.
Juice. Yes. Water. Juice. Juice. Water. Juice. Orange juice. Water. Juice. Orange juice. Juice. Water. Juice.
This is before treatment. Now, after treatment, we see what you can do.
Juice. Water. Juice. Water. Juice. Water. Juice. Water. Juice. Water.
Okay. I've been doing that. So then at 20 weeks, when we follow up, the mother was happy because was able to call mommy out, was able to ask and point his hand to morphine that he wanted. So the improvement is continual. So pretty much that's all the testimonies. And just for those that may be wondering if the NTNS is available at our center, yes, we have a US protocol for weight loss. We have shockwave therapy. We have MESPA, anesthetic services, cosmetic, primary care. So we just don't dump you. We make sure that you are well. And of course, we offer regenerative medicine, which is why we're online today. But for those that don't know what shockwave therapy is, this is what it is. So it's just in a probe sending sound waves to regenerate or stimulate the healing process in the body and reduce the inflammation. So this patient that's been treated had what do you call it? Back pain for about 3 years, X-ray, everything been done, no pathology found, and before the treatment was 8/10. A month later, it was 5. Then about 5 months later, when I follow up, about the pain, the patient said, "Oh, if not that you reminded me about me having backache, I would not have remembered I had one. So, all right. And then this is another one, neck pain, who had a fall, and I think for about 5 days. And then the next day, said 95% gone. And for those that are raising your hands, we know that you are raising your hands. We are almost done. We will get to you. And when I asked the patient to quantify the next day, it went from 7/10 to 1.5. So pretty much that is our presentation. And I have one more testimonial of one of us who is attending, who wants to, share her own testimonial life. But it's not just about her treatment. I think she has something to say. So I'm going to give her the opportunity to speak. And let me see. Okay, that is it. Over to you.
Can you see me? Can you hear
Yes.
me?
Yes.
Hello, my name is Rebecca Obayaton, and I am a recent patient of Dr. Ikudiasis, and I actually asked him if I could be here to share a little bit of my story today, just because when I experience something really great or truly believe in something, I'm compelled to share it. So just a little bit about who I am. I am American and have lived in the US for almost my entire life. 22 years ago, I met a handsome prince, a Nigerian prince in Philadelphia, of all places. And at the time, I didn't know exactly what that meant, but as fate had it, he swept me off my feet, took me to his village, and since I did not run away, he married me in a traditional ceremony there. So the rest is kind of history, but we did continue to live in the US, mostly in Tampa Bay and Orlando. So my background is in exercise science. I've always been fascinated by science and kept up with, what's happening with cutting edge things. And I owe a lot in my life to medical science. When we were trying to have children, we ended up turning to IVF, and I researched the latest techniques and the best doctors that were out there, and kind of found my way through that. And anybody who's been through it knows the financial and emotional and physical toll it can take on someone. But ended up having a success story there. But the day that I found out I was pregnant, I also had to go in for a biopsy. I discovered that I had a cancerous lesion in my tongue. So once again, I started my research and needed to find, what was the best thing I could do and who should do it, because I needed to make sure that I had a healthy pregnancy. That was my top priority. So through that, it's a success story. I was able to have surgery, continued on with a fantastic pregnancy, and had twins, actually. So I have my boy and girl, and life is grand. But a few years ago, when I started hearing more about stem cell and the therapies that were available, I just was intrigued. Started doing more research. I didn't have a specific application for myself at the time, but I was just really driven to find out more about it. And in my research, I found, one of the top doctors, world-renowned around the world, was Dr. Ikudiasi. And full disclosure, I knew him. He wasn't a close friend, but definitely a medical colleague of my husband's and a friend from Tampa. It's a close-knit Nigerian community there, so we did know each other. So I just started following his work a little more closely at that point. So fast forward to this year, my husband was appointed a position here in Nigeria. So I'm now coming to you from Lagos. And as I became more interested in some of the anti-aging and PRP therapies that I was seeing with Dr. Ikudiasi, I was excited to learn that he was here in Lagos as well as Tampa, my two home bases. So So I contacted him just a couple of months ago. He can probably share with you more the dates, but I contacted him, and just because of my travel schedule, we found it best to meet in Tampa. So I went to see him, had my consultation, got all the information that I needed. My main concern was I did not want to change my face. I didn't want to change how I looked. I was under strict orders from my husband as well, like, do not change how you look. I love your face. But I love that this is natural and using your own blood, and it's more of a preventative thing. For me, it was just, I wanted to really dive into my skincare and make sure that I was doing the best things for my skin, starting to notice some wrinkles that I didn't really care for. But again, with that said, I also didn't want to change my appearance. So got the information I needed, and within a couple of days, went in for the procedure. So that's kind of my approach. I don't waste time. And you've heard the doctor say it a couple times through the presentation. I think, financially and medically, there's reasons not to wait. And I think even from a quality of life standpoint, that's really my drive. Back to my story of how I got my family and the medical diagnosis I had through that. It was a turning point for me. And I just decided that I don't have time to waste, and I'm going to live my best. And I think that always comes back, if you're feeling your best, whether it's, regrowing your hair or whether it's walking again. I mean, these stories that you tell are incredible. I'm blown away. I've seen this presentation once before, but I'm again blown away just by the gravity of the work that you do. But I have to say that it can be anything from anti-aging skincare to, again, regaining the use of a limb, to having a better sex life. I mean, once you are living your best, that just comes through in every aspect of your life, and you're ultimately going to be more successful in your everyday life. So, over the years, I'm sure we've spent thousands of dollars on, insurance, health insurance. And I'm not saying we shouldn't. There's definitely applications for that, and there's a place for it. But I've never been one to sit back and wait for the insurance company to tell me what they're going to cover and what the best treatment for me is. I kind of work with a doctor that I trust and move forward because time is of the essence. So that's my message and my testimony. I did have PRP therapy, which the doctor can tell you a little bit more about. I did have the exosomes. I had really no downtime. I did not look very good right after, but I was still able to see my children, who are 8 years old now, still able to see them and see a girlfriend, really with just an explanation of the procedure that I had. And within the next day or two, I was fine to be out amongst people, and really no physical feeling of being down. I felt fine afterwards. And using the exosomes, I think that was the reason. I really didn't have a whole lot of peeling of the skin or anything afterwards. It was a pretty quick healing process, and I'm happy with the results. I wasn't looking for an overnight change. Like I said, I didn't really want a change of my face, but just a freshness. And I'm continuing to notice differences. And funny enough, I've never really had any compliments on my skin before. And just about 4 weeks ago, I saw a friend, and she's like, "Your skin is so beautiful." She just randomly said that in the middle of a conversation. So I didn't actually tell her at the time about the procedure, but I just told her that I was doing things to take care of my skin. And I just thought it was quite ironic that I just had the procedure, and for the first time, somebody actually commented on that. So again, that's my testimony. I would just encourage anybody who's thinking about any application for your life, get the information that you need. Don't waste time in that, and move forward so that you can start living your best. That's all.
Thank you. Thank you, Mr. Byton. Well, appreciated that input. So because of time well spent, people have been raising their hands and have questions. I'm just going to go straight. Pretty much we're done. So I believe we have a better understanding of platelet-rich plasma and what adult stem cell therapy is all about. Again, the goal is to create awareness so that people can reach out to their doctors, or if they offer it, or find out where they live. If we don't, the wealth, of a nation can be measured by the health of the people. So we just want to make sure that people understand. You have a stroke, don't write yourself off. You have arthritis, you can't walk, don't wait till it gets to the point you need hip replacement or knee replacement. You can quickly reverse things, get back to your functioning state. The earlier, the better. We don't promise cure, and even if you go to a center that does this anywhere in the world, nobody's going to promise you cure. Please remember that. Yes, you get incremental improvement for each one. Yes, there are some that looks like cure. We just try to avoid that word. We let you choose any word you want to use. Our sickle cell treatment is also treatable, but we don't currently do it at our center. Again, the goal is to reduce medical tourism so that Nigerians patients, they want it. The knowledge is available. People all over not many yet, but you can get these treatments, at some centers in Nigeria. It's not about us. It's about you. Nigerian patients, they want this for you understanding that, you don't have to stress yourself that you can't get visa or to do something. Mind you, it's not for everything. If you need to be treated and you need to be in ICU, you have to be good there. Now, if you're in a coma state or your family member is in a coma state and they've done everything, they can't bring them back. Yes, regenerative medicine can be added to bring them back quickly. It doesn't replace the general medicine or orthodox medicine. It supplements the current orthodox medicine. So thank you for your time. Thank you for staying there this long. And if you have more questions or you need to read more, the website address is there. We are located in Lekki Phase 1. And I'm going to, I think I'm going to ask Dr. Kolawole to take over. Sorry, just a second. All right, so over to you, Dr. Kolawole.
Yeah. Thank you very much again, Dr. David, for a thrilling session again. It was really excellent. Thank you very much. And I can tell those who are joining us for the first time that, from the last webinar a few months ago, there are several new testimonials that have been added to our stockpile. And I'm just hoping that very soon we'll be able to have a publication of, the host of good testimonials that we have of the results we are getting at Glory Wellness Clinic. So I'll go straight to the questions. And what I've done tonight is to categorize them into the questions so that we can address identical questions in just one fell swoop, in one breath. So the first set of questions that we will talk about are those that pertain to the procedure itself. So the first, the questionnaire that says that asks if fat cells can be taken from another donor. So that's one question. And then another question in this category is if exosomes can be combined with stem cells, of the other types for treating very old problems, very chronic ones like stroke of 5 years duration. So let's handle those two questions first, sir.
Okay. Yes. For the allogenic fat transplant, which means taking fat from somebody else, is doable. I've done it before, but you have not directly. You have to send that to the tissue bank. They have to process that fat so that the recipient has to use it. That is becoming more complicated and not easily accessible anymore. And I will shy away from it because of the time it takes and the storage and the processing. That being said, you cannot take fat from one person and give to the other. It's just like doing blood transfusion. They have to be compatible. That person's fat has some, blood component in it, and we have to check for the HLA, MHC, and for adult to adult, that is comes with risk of rejection. It comes with risk of problem. So I will not do that, and I don't. It is in US, yes, it is doable, because there are some tests that you have to do that allow it to be doable. In Nigeria, I don't think we are there yet. And for the person that is asking about exosomes and whether adult stem cell therapy, the answer is yes. That means you can combine and you get a better result. And the hip, I forgot to mention, the hip regeneration, the right hip that we treated, that significantly improved. Even doctors have asked me, did you use PRP? Only the PRP only cannot give you that much result. Like I said earlier, PRP is the basic. When you add fat, in that case, we use PRP fat and bone marrow. I had to do bone marrow aspiration. I mean, she didn't feel it, although that's supposed to be a painful procedure. If it's done properly, it's doable, you combine it and the patient will get better result. I did not add exosomes, but yes, I could have added exosomes or umbilical cord, But I was having 3 things on board. She already had all that she needed, because all these things that are already made, they cost money. They are from US. US is in dollars. Our naira is not stable. So the same exosomes of maybe 10 naira today, in 2 months' time, maybe 15 naira. Because it's not, the dollar doesn't change, but with our naira. So over to you, Doc.
Okay, thank you for the answer. So the next question, okay, on that same question, I think Bessie also wants to know this combination of modalities. To what extent can it influence recovery, because it's a 5-year stroke? So how does that change the dynamics of recovery for someone who has had a stroke for over 5 years?
One treatment alone is still not going to do it. What it's going to do is going to stimulate the regeneration of the new neurons faster, so that they can get better results. That patient will still need more than one treatment session. If you compare somebody with combination therapy to somebody getting only one of the adult stem cell therapy, the person getting combination is going to do better. Research studies, it's all on NIH.gov, has shown that. So it will shorten the duration to the expected goal, but one treatment is not going, because you combine, it's not going to be enough. So the patient will still have to do more than one treatment session. So I'm guessing, I don't know whether it's a doctor that is asking. So at your center, if it's a doctor, you have to let the patient know upfront. Yeah, you're not promising cure. It's just tell the patient there is going to be need for multiple sessions. And if you want to get faster to your goal with less number of treatment sessions, combination is addressable, but more expensive. Over to you.
Okay, thank you, sir. So the next question is about, I will also combine the questions into one. Does this involve surgery or cutting of the body? How painful is the procedure? And then particularly for diabetes, how is this procedure administered?
Okay. There are so, like you say, there are so many options that I offered. The only thing is that you cannot use PRP. Okay, that being said, I use PRP for diabetics, but for a different purpose. It's one of my mentors that has a way of using PRP, but not the way we use PRP directly. Okay, so PRP is not going to really deal with diabetes. It is adult stem cell therapy. I don't use knife, I don't cut. Even when I do fat, at our center, when we do fat, we use needle to make our hole. So when patient leaves, we don't stitch because we didn't cut. And of course, we still do everything under sterile condition. We gun down and we harvest the fat. We process it. It can take like 6 hours to 8 hours, depending on how much fat you are doing. Not with the patient. With the patient, it's only 1 hour. It is the doctor that has to work for roughly 6 hours to extract the stem cells from the fat. Then when you have the stem cell from the fat, it's just like 5 minutes treatment for diabetics. If you are treating back pain with it, it could be 30 minutes or 1 hour or multiple joints. But for diabetics, for if it's multiple sclerosis, there are different routes of transplanting it to the patient depending on what you are trying to treat. So I guess the another thing to mention is it is outpatient. We do not, at our center, we don't keep anybody overnight. If it's the 8-hour procedure, you come in very early in the morning. So we get started and then we let you go. There's really no downtime. I mean, you can see Mr. Byton, although HAS is simple, HAS is just PRP, but the bone marrow aspiration, there's no downtime. The patient goes on. The only one that needs follow-up is the liposuction because you are taking out fat. So the patient has to follow instruction to prevent accumulation of fluid or blood under the skin. And it's not liposuction to make the patient skinny. If you do it that way, you're going to kill all the stem cells. That's why we don't cut. So it has to be done in a proprietary special way. I hope that answers that person's question. So no data.
Thank you very much, sir. Okay, I think you didn't talk about pain. How painful should people expect? How much pain should they expect to experience?
Okay, and during the procedure, we normally, all of our patients is awake for liposuction. We don't put anybody to sleep at all, so we numb the area. And in some cases, we even go for that to make sure that they don't feel anything from the above the belly button all the way down for the next 2-3 hours. So we are talking, they see me doing it, but they don't feel, they don't feel anything. So it's not painful. But after, I have people that go to work the next day, after even having this liposuction, again, it's not about making them skinny. That being said, some people are very sensitive. So those one we need maybe Tylenol, paracetamol, maybe Cocodamol for 1 day or 2 days. And most of them I only took 1 or 2. After that, I don't need doc. I don't use it. So everybody is different. So it's not painful because we make the patient very, very comfortable. Very, very comfortable. No pain. But that being said, let's say we are treating the knee or the back, even though we numb the skin, we don't put them to sleep because we want to make sure that we are getting the bullseye. So they will feel the needle prick. And some people that have very low pain threshold, they feel the procedure, but 5 minutes before they get off the bed, the table, they are good. That's why they go home and they don't even take their pain medication. Yes, go ahead.
All right. Thank you, sir. So the next session I'll go to is disease applications. So the first question I will ask in that regard is, so I'll just mention disease one after the other, and we can say 1 or 2 words on them. What's the use of stem cell therapy for proliferative diabetic retinopathy and atrophy of the optic nerve? I believe that's what person wanted to say.
Okay. Now, The anything that has to do with heart, if it's someone autoimmune disease, for example, I'm talking generally now about the high issues. Even macular degeneration, which comes with aging, evidence shows that stem cell therapy helps. The major challenge with the heart is the glaucoma. Either it is open angle or close angle or things that have to do with mechanical or structures. Stem cell therapy has not been really helpful in that area. So there are evidence that both diabetic retinopathy, idiopathic or proliferative retinopathy, any kind of any pathology that allows blood supply to the part of the eye, which means the stem cells too can reach there, it will help the rejuvenation and restoration of that organ. In this case, is the eye we're talking about. It's just that glaucoma or lens which, problem, which is cataracts, those ones have not benefited well from stem cell and therapy. But generally, and then those that are not an ophthalmologist, but those that work in ophthalmology centers, eye doctors, they even go as far as trying to get the stem cell treatment either directly or close to the eye. And, of course, that's not something that I do, but they want to get better results so that way the patient can get a wow or faster result. Are there centers doing that in Nigeria? I'm not sure. There may be, but we don't inject into eyes at our own center. We treat indirectly when we do the eyes. The total body regeneration, some we get to the eyes. That's how we address the eyes and help the patient to get better. I've treated the patient for kidney problem and an accountant who couldn't pass because he was writing across the straight line, and treated for kidney and diabetics. And then later on, 4-6 months later, he was able to pass his exam simply because his vision improved and he could see better. So yes, it does help in some cases. Over to you.
Thank you, sir. So the next question is, can it be used for the prevention of prostate cancer?
Okay. That's an interesting question. Prevention of prostate cancer, or prevention of breast cancer, or prevention of colon cancer, or whatever. I would say the answer is no, not that. But one thing I know is its anti-aging effect. It can, the person's asking about, for example, enlarged prostate, BPH, evidence have shown that it can reduce the size, the inflammation, that's hyperplasia anyway. But for cancer, no direct effect for cancer. Even patients with cancer, we want to wait 5 years before we touch them. So for prevention of prostate cancer, I will say no, but I may be wrong because NIH.gov, somebody might have published something that they notice that there's less prostate cancer in their population of patients. But of the book, I will say no to the little knowledge of mine. Over to you.
Yeah. What about heart failure, sir? Heart failure.
Yes, I mentioned earlier, there are two conditions that adult stem cell therapy is good for when it comes to the cardiac system. That is heart attack, myocardial infarct. When somebody's heart is deficient of oxygen and section of it is dead, you transplant stem cells there. You either prevent, if it's done quickly, you can prevent all the cells from dying in that section, or promote multiplication of the surrounding heart cells or muscle cells so that it can differentiate and over time replace the dead one. And when heart failure has occurred, that means the heart is not, the first part is heart attack. The second one you can use it for in cardiac disease is the heart failure, which is what the person is asking. When the ejection fraction, the ability of the heart to pump has reduced, and the person is even waiting for heart transplant. You put them on adult stem cell therapy. What happens is that you are remodeling the muscles of the heart, strengthening it, rejuvenating it. What happens over time is that the ability to contract and pump increases. They found out that the ejection fraction also increases. There have been cases of people that they couldn't find a match, and eventually they will end up not needing a match, a donor, rather. And they were able to still live a good life, have a good quality of life. So the answer is yes. Back to you.
Yes. What about gout? Okay, I'll just mention a list of them one after the other. Gout, cervical spondylosis. Gout and cervical spondylosis.
Okay. For gout, gout problem is either overproduction or under secretion by the kidney, and that is why we ask the patient to eat less certain kind of food. But if the problem has to do with the kidney not functioning well to be able to excrete, in that case, yes, the kidney functionality can be improved. But if it's overproduction, that is causing the body producing more than it can excrete, it cannot be used for that. It can reduce the inflammation that happens in the joint, because most of the gout will come in either the big toe, the hair, or the knee joint. It can reduce those inflammations, just like steroid will do. And then it can also affect the functionality of the kidney if the person is not excreting properly. So that is kind of alpha. But when it comes to cervical spondylosis, which is arthritis of the neck, any kind of arthritis, when under the list of orthopedic slide that I showed earlier, that was one of the first thing I listed. So it's low back pain, lumbar spondylosis, cervical neck pain, cervical spondylosis, and facet arthropathy of the neck or the low back. It works very well. In ordinary blood, you don't need to go and be spending money on bone marrow or the expensive one. Just ordinary blood. We take care of that.
Right, sir. What about degenerative neuromuscular myelopathy?
Come again.
Degenerative neuromuscular myelopathy.
So what's the question with that? I mean, if you can help that.
Yes, if that can benefit.
Okay. At our centers, we've not had any patient without diagnosis yet, but I believe for patients with similar diagnosis, I believe I've looked on the nih.gov, which if the person asking is also a doctor or even maybe a patient, nih.gov. You can type in adult stem cell therapy, for your diagnosis. And my only concern is for such condition, it's going to take time. It's going to take multiple sessions, and probably going to be expensive because I do multiple sessions. So it's a possibility. So where orthodox has said no, yes, adult stem cell therapy may help to improve the quality of life. Like again, incremental improvement, not go for one treatment and expect to be cured. It's not going to happen because that's a chronic disease. In science, we believe that when the brain is dead or the spinal cord is paralyzed, especially after 1 year or 15 months, that's it for the rest of the life. And that is why the body that is paralyzed for 2 years, from the neck down, the top neurosurgeon in Nigeria said, David, don't waste your time. But now we are friends because he saw the kid a year later, even reverse. So, but the challenge again is multiple sessions. It takes time. And I know by our culture in Nigeria, we are Jehovah sharp, we want it here yesterday. We have to change that mentality if you have some conditions. When the doctor says it's going to take time, don't say, just give me one treatment, I'm going to go to the mountain. Don't get me wrong. I'm not saying miracle cannot happen. All I'm saying is on the scientific part, when multiple sessions is needed, before you start the journey, be ready for it. Otherwise, you get some partial improvement. If you're happy with it, God bless you. But if you want more significant improvement, you have to do more than one treatment session. Over to you.
So when arthritis has become bone on bone, is this procedure still effective?
It doesn't even matter whether it is your hip or your knee. When it's bone on bone, the procedure can still be done. The inflammation will be slowed down, it will reduce. The only challenge with bone on bone in some cases that you may need to do it one more time. And then that being said, you also have to do things like combination therapy, bone marrow, fat, and PRP. If all you have is, or all you can afford is PRP, all you are doing is slowing down or reducing your pain, which means every 3 months or 6 months, you're going to need a touch-up. And then right now, there are even more affordable PRP in Nigeria than when this started 5 years ago, 4 years ago in Nigeria. If you are going for the cheap one, which I refer to me like the Keke Napep, it's going to get you to your destination where you're going, but you have to understand that it's going to take time. You're going to need more than one treatment. The arthritis of the hip that needs hip replacement that I showed, that person has already knows how much it costs to do total hip replacement in US when she came. So she wanted the best possible. So there's no need to play around. So with the high end of the PRP, because PRP is also comes in cheap end and high end. The high end of the PRP plus fat, I think that double, triple dose fat, plus bone marrow, all those things were combined. That is why she was able to have that continual, only one time that was done. And you can see how the hip was regenerating. So for bone on bone, yes, it can be done. But remember, it's bone on bone. So as you are regenerating, there is no space. The bone is still grinding. As you grow fresh cartilage in between, as you walk around, you are scraping it up. So it's a tug of war. So definitely, you're going to need a touch-up treatment, especially if you are going for the cheapest option. So it's possible, yes.
Okay. How can this be applied to treat stretch marks? That's aesthetic now.
Yeah, it's the people use for stretch marks. It creates collagen. I mean, if you Google it or YouTube or whatever, it can be used. People use for stretch marks. It softens it. It improves the collagen, but probably depending on how stretched the skin is, whether it's after pregnancy or whatever, you will need more than one treatment. Again, in Nigeria, you want to do it, you want result right away. I mean, stretch marks, the skin has been thinned out. You need collagen to come in. You need to rebuild that skin. And yes, you can be using cream to prevent it, but these procedures, they stimulate, they accelerate the building up of the collagen in the skin. So you're going to need more than one. After one, you will see improvement, but you won't see a cure. So if you're happy with one treatment, no problem. If you want further improvement, then you do further treatment session. Yes, over to you.
Okay. Then is the response to autism, how fast they recover, how much they recover, does it depend on the age of the patient treated? And then, so okay, that's the first part of the question. I will ask the second part.
Yeah, at our center, we've treated, even right there in Nigeria, we've treated from 3 years old to 31 years old. We have 31, we have 19, and I have those slides, I took them off, because there's so many to show. So the kids, I showed the video, the kids respond well, but for autism, a child will need average of 3 to 4 sessions to then you reassess the child, and the child will be able to interact better with the family, increase their ability to speak, but not to cure them and they just become 100% normal. You just try to get them to where they can interact in the society, be less dependent. So that's kind of, and then it's less stress on the caregiver or on the family or the parents. So yes, there's improvement, but we are not promising cure for the autism. But over time, even if you go on Google, you see some children in US who couldn't talk, and within 6 months they start talking fully. So it also depends on the severity of the client initially at the start of the diagnosis. So it helps, but people shouldn't get into it or do it because their child that cannot talk today or always sitting down, not interacting, they want it next month to start talking. That is too much as expectation. They have to bring the expectation low so that they can see and appreciate every increment. Like within a couple of weeks, we treated a child, I think 4 years old. Every time he poo-poo, he take his hand and smash it on the wall in the bathroom. The parents said after the treatment, he will go and wait for you at the door of the bathroom. He will pull his pants down. It will not mess up anywhere in the room, and neither does it use his hand to take a poo-poo and smash around the wall. That's a great improvement in that child, because, so the brain is being reset, it's being regenerated. Of course, there are many testimonial different ways, but my point again is that don't expect cure, because here's the deal. Things for autism, there are biologics that are not made in Nigeria. So there's no way they're going to be extremely cheap. Arthritis, where we've been able to make it like 10 times cheaper compared to what people used to do in Nigeria 5 years ago. I don't know about other centers. Just find out where the center you want to go to, what they do, how they do it. And if you are comfortable with it, just get it done there. But if they are getting products from or whatever for you as a patient from outside this thing, be realistic and and just understand that you don't have to travel abroad. They bring this to you, and our naira is not stable, so that way you can, your expectation will not be too high because you're spending XYZ amount of naira. So it is the autistic child is going to take time, gradual and incremental improvement for every additional session the patient has. Over to you.
So for autism, what's the way to administer the stem cells for autism?
For autism, I think that's a clinical question, and that will be discussed if it's a patient at consultation, if it's a doctor that person have to be trained, because this webinar is not to train people to go and start doing something quackery and then, next month in Abuja, there's a Wonka conference, the 7th Wonka on the African for doctors. I've been invited to be a speaker. So if it's a doctor, you can meet me there, but otherwise I can't make such a statement online, and then people start telling their doctor, you can get this and do this. Then somebody died, then they come and I'm sorry. Anything with that to do with cost or treatment, that is all what this seminar is about. This webinar is about creating awareness that people don't die because of lack of knowledge. They just need to understand that there is hope. They just need to find a center near to them where they can get help, and they don't have to be in depression because they can't get visa to UK or US to get this treatment. That there are people doing this in Nigeria.
Thank you, sir. So another question in this category is, can someone who already has implants benefit from regenerative medicine? There's no clarification whether it's aesthetic implants or maybe arthritic implants for arthritis, but maybe we'll try to address both possibilities.
Yes, I think most likely the implant is probably going to be orthopedics implant, I'm guessing, because I'm trying to picture out which implant will somebody will still want. So if somebody has an implant and they still have pain, most implants, whether it is metal, which is on a ball socket joint, or one part of maybe the knee, maybe one side is implant, is a foreign body, you cannot touch or regenerate a metal. But if the ligament or anything surrounding or holding the joint together is overstretched or is sprained or strained, you can use regenerative medicine to strengthen it and make reduce the pain and make those ligaments stronger.
What is the time interval between multiple sessions, and can multiple sessions be achieved in a single day?
No. It depends on the person's severity, the severity of the condition, the type of diagnosis. There's a lot of things that goes, and it also depends on the type also of the regenerative medicine procedure that is being opted for. So these are things that a doctor will discuss with the patient at the time of consultation, so that, because it has to be individualized. So when the patient calls for consultation with their doctor, then the doctor at the center should be able to tell them how this is going to be done, because one size doesn't fit all.
So the next set of questions have to do with complications. So I'll go straight to that. Someone asked what are the complications of and long-term adverse effects of regenerative medicine?
Okay. Now, regenerative medicine itself is a broad topic. Under regenerative medicine, we have tissue engineering. We have stem cell therapy. Then under stem cell therapy, we have 3 stem cell therapy, which I already mentioned. Of those 3, one of them has the embryonic, has a lot of negativity to it. The second one, induced pluripotent, it used to be a lot of side effects, problematic. Now the scientists believe that they can keep all those things under control, so they started the clinical trial. The one that we're talking about is adult stem cell therapy. So, which is, of course, is under regenerative medicine. So that's why I'm breaking this down, because I don't want to make a statement and people just generalize it that this is what I said with regenerative medicine. That's a big topic. But under adult stem cell therapy, there's also autologous and allogenic. Autologous means from that person to that person. Allogenic means from one person to another. In allogenic, you have to find a compatible donor. They have to match. In autologous, it's your own body part. The risk of rejection is 0. Now, are there complications, maybe infection and even the lidocaine used to numb the skin? If somebody can react to that. The antibiotic that you give during the procedure, not all, some of the procedure, you can be allergic to penicillin, for example. So those things are there. But if you put those aside, autologous adult stem cell therapy has no risk of rejection because it's your own body part, So pretty much it's just like dialysis. Your body leaves you and goes to the dialysis machine, and it comes back to you. Is there a risk of infection because the machine is contaminated? Yes, but not because you are getting your own blood back. Yes, people do Brazilian butt lift. You take your fat from your stomach into your butt. There could be complication because of the procedure. or you sitting on the fat and it dies and causes infection, but not because of your own fat going back to you or putting your own fat in your lips. So those are so the answer is for autologous, risk of rejection of the stem cell, is not there. But yes, there is, because of the way the doctor does it, because of the environment, there's risk of infection, there's also some risk, but not really because of the stem cell therapy itself.
Thank you, sir. What is there any risk for fat embolism using fat-derived stem cells?
No, for the fact that if the person is, that is, again, I mentioned earlier, it's about 1 hour to get fat from the patient. You spend 6 to 8 hours extracting stem cells from the fat. So it's not, I'm not training or telling anybody to take fat and inject it. If you do that, the patient will die before you finish injecting. So if somebody does that, fat embolism, that is not stem cell therapy. That's not fat stem cell therapy that I'm talking about. Yes, for that person, but not the type of the stem cell therapy that I'm talking about. So the risk of fat embolism is no. Because you have to be trained, you have to be, do it the right way. So yes, hopefully that person is not a doctor and think that you can go and just harvest fast. Instead of spending 6-8 hours to get the stem cell, you just go and throw it somewhere. You will kill somebody. Again, that is not, this is not about training people. This is about, thousands of dollars and days are spent to learn these things. So I hope that person is not a doctor trying to do something. Please don't associate me with you if you're a doctor.
Thank you, sir. Well, this is a short question. How painful is the P-shot?
The P-shot, depending on how it is done, there are a couple of ways to numb the area. Some you feel needle prick, and some you don't feel anything. So it depends on the option that the person opt for. But the way we do it, 99% don't feel the needle at our center. But again, patient's threshold is different. Or sorry, patient pain threshold differs from one to another.
Thank you, sir. So the next question has to do with our results. This person asks that we've mentioned our success stories, but have there been some cases that were treated unsuccessfully?
We've had a couple of patients that did not respond to the first treatment. And again, like I've said earlier, chronic conditions desires multiple treatment sessions. On NIH, studies have been done comparing for some conditions whereby people have 4 treatment sessions, 3 treatment, 2 treatment, 1 treatment. 1 treatment in some condition is not going to give you any result. In some, 2 will not. Some start from 3. That being said, it doesn't mean that everybody is going to respond. Acute injury, we always have 100% recovery. The ones that I may say maybe are not satisfied is because their expectation is probably higher than what they were explained to. And like I've said again on this, you need more than 1 treatment. So if you now decide not to go for the second treatment because you did not get a wow response, for me, that's not the treatment failure. But for the patient, they may consider it because their body did not respond as fast as they want. They may say it's a treatment failure. I'll consider a treatment failure when at our center, we recommend 3 treatments for you, and you complete all those treatments and you don't get any improvement. That is a treatment failure. Now, if you get improvement, but it's not to the level that you want, that means you just probably need additional treatment beyond what we thought. And that is why, if you all noticed, from what I've been saying from the beginning, I try to keep the expectation low. I try to tell people that don't come in and do one and go to the mountain and expect miracle. I already said that. But if people's attitude are going to be like that, then they're going to say it doesn't work. So that is why I really can't say that there's been any treatment failure. I don't promise cure. Again, I wrote it there, no promise of cure, incremental improvement. But again, our culture, we want it yesterday, we want cure. Something that happens 30 years. You can't be patient for 1 year. Look at the x-ray, let's use the face, the acne, let's use the x-ray so that we can all see that. You see how the improvement continues. Just though not just one treatment, it's a combination, but over time, patience is virtue. And just like erectile dysfunction, I said women respond quickly, but men needs longer time. So if you okay, the female genital mutilation, she waited 3 months to respond. In her final comment, she said 3 months later, she started improving. She saw my text at 2 months, she did not respond. But if anybody asks her, then, how's your mutilation treatment? She say it doesn't work. So whoever she has spoken to in the first 2.5 months, you say, hey, don't waste your time, it doesn't work. But what happens from month 3? Look at what our response is. So patience is virtue. So I hope, and then people may not be satisfied. I'm not promising everybody's going to be satisfied. Fingers are not equal. We are going to respond differently. What I'm saying is that if you tried everything else, and doctor says there's nothing else you can do, there is hope with regenerative medicine. I didn't say there is a cure. There is hope with regenerative medicine. Yes, some of the things may look like cure, but again, we don't go that route because everybody will respond differently. Some want treatment, some 2, some 3. So that is what I want people to know. Thank you.
And thank you, sir. There are, I think, 1 or 2 more diseases that we need to talk about. So, sir, what's our experience with avascular necrosis of the hip or the neck of femur?
Yes, the evidence shows that if you use fat, bone marrow, you can improve people's pain, create new formation of blood vessels in avascular necrosis cases. And some of them, in some evidence, you even need orthopedics to kind of, they make more like a medical cement with the bone marrow and then carve out the dead head of the femur, and then, or maybe if it's the humerus, the shoulder or the hip, and then, you implant the stem cells. At our center, I've not personally treated avascular necrosis. The hip that I showed, that is stage 4 advanced osteoarthritis that with multiple cysts that needs total hip replacement. We're able to regenerate. The MRI did not say anything about a vascular necrosis incident in that joint. So I cannot give my own personal experience or at our center, but answers are available on nih.gov.
Please, I'm not sure. I think maybe you should just emphasize again, on the matter of treating sickle cell disease. Please, could you talk about that again, sir? I know you mentioned it earlier, but tell us about that.
Yes, the sickle cell disease, we don't treat that at our center yet. That involves using a donor's bone marrow, which you get from a family member, because families are always the closest donor for the bone marrow, and the person can now go from, I will call it, genotypically remains a sickler, but phenotypically they are cured. In other words, they stop falling sick, they have a life like AAA, but when it's time to get married, they are still considered SS. So you can use bone marrow to cure them, they have good quality of life. You can also use umbilical cord stem cells, but that has to be freshly harvested. That also comes with low dose radiation therapy, and then you can avoid chemotherapy when you're in the protocol for the umbilical cord stem cells. But in the traditional bone marrow transplant, you still have to do chemotherapy and radiation therapy. And then there's an age limit to, I think, to the bone marrow, protocol. So all these are available. It's not something that we do offer. Some patients may have to travel abroad for that, or they Google it. I know they do it in US and also some European countries, but not at our center. The only thing we do for sickle cell patients, or we can do, is sickle cell patients too, they do get stroke. And unfortunately, sometimes they get multiple stroke. So the damage that can be done to the brain can be reversed by existing protocol in Nigeria, and also at maybe other centers that do what we do, but not converting sickler to non-sickler.
Thank you, sir. May I also add that in addition to mitigating complications of sickle cell like stroke, some of them are also, they're also at risk of having non-healing wounds. And, we've spoken about that earlier. And so some of them can benefit from, treating. We can use our protocols to treat their non-healing wounds, and they can heal very fast.
That's correct.
Thank you, sir. So those are all the questions that are, within the scope of this webinar. The other ones, and there's one from a journalist who would like to do a report on our transcript. So the person can contact us from this the displayed address and email and phone number. And then there's one of our medical colleagues that wants to know about getting into this line of work too. Dr. David has already said that colleagues can see him personally as well. And then on the matters of price, because there's such a wide range of pricing, there is not this kind of thing we'll discuss here. We can't exhaust it. So please contact us again. So we can discuss with you, and then based on your particular illness and your budget, we can arrive at something that can be beneficial to you. So Dr. David, thank you very much again for a wonderful evening. And thank you, our guests, for attending. And most of us have stayed to this point. We are grateful for your presence. Yes. And I want to thank our guests who came here to give our testimonial, Mrs. Obaiton. We are really grateful to have you. And I want to thank my brother, Mr. Demitope, for joining us. He has been busy earlier on. It's been a wonderful evening. Thank you very much. Again, my name is Lekon Kolawole.
Thank you, everyone. Thanks for your time. Have a nice and wonderful evening.